CodeTree initiative.
Today, Chloe, I want to start with something that's a bit uncomfortable, but really important. Have you ever noticed how sometimes when a patient is clearly struggling emotionally, the healthcare staff can seem flat, almost cold?
Absolutely. And I don't mean professional in the usual sense. I mean cold, like the patient is just a task to be completed, a number, or a body to be managed.
Right, and most people assume that means the staff just don't care.
But what if it's actually the opposite? What if they care so deeply, for so long, that their brain just hits the emergency brake?
That's exactly what we're unpacking today. The emotional numbness healthcare workers develop as a survival mechanism after repeated exposure to trauma, sickness, and death.
And this numbness isn't just a problem for the providers. It directly impacts the patient experience and even clinical outcomes.
So let's start by defining what emotional numbness really is. Is it a choice?
Most of the time, no. It's an involuntary survival response. Think of it like emotional scar tissue. When you're exposed to trauma over and over, your brain pulls the emergency brake to protect you.
That makes sense. Like an ER nurse who sees a child with severe injuries, a spouse collapsing from a stroke, hears screaming, sees blood and fear, and then has to go eat a sandwich to keep functioning.
Exactly. Patients often see that and think, how can you be so normal right now? But healthcare workers have to appear normal, or they risk breaking down emotionally.
So numbness starts as a defense. But what happens when it becomes the default mode?
That's when things get dangerous. Care can be technically correct, but emotionally absent. It's like saying, yes, I treated your infection, but I didn't treat you.
And patients pick up on that immediately. When you're sick, you're vulnerable. If the people helping you seem detached, it feels like you're alone in a room full of professionals.
That emotional absence can make patients spiral. Illness is scary enough, but indifference makes you feel like you don't matter.
Now, burnout is a term we hear a lot, but I think it's often misunderstood. People think it just means being tired.
Right, but in healthcare, burnout is much more complex. It can look like exhaustion, sure, but also irritability, emotional withdrawal, cynicism, or that numb, dead face.
And the scary part is, many healthcare workers don't even realize it's happening. It sneaks in slowly, like turning down the volume on your empathy without noticing.
That's a powerful image. And it's important because it shows how gradual and insidious this process is.
Let's flip the perspective for a moment. What happens on the patient side when they sense this numbness?
Patients often blame themselves. They think, maybe I'm overreacting, or maybe I'm annoying, or maybe I'm not sick enough to deserve attention.
And that self-blame leads to silence. Patients stop advocating for themselves, which is a huge problem because in today's healthcare system, you have to constantly advocate for tests, referrals, pain management.
Exactly. If the system makes you feel like a burden, you stop speaking up, and that can worsen your care.
And here's where it gets really serious. This numbness isn't just about feelings. It affects patient safety.
When healthcare workers become numb, they start seeing patients as categories instead of individuals. Like, oh, this is another anxiety patient, or another drug seeker, or another chronic pain patient.
And once you label someone, you stop truly listening. And when you stop listening, you miss critical information,
which can lead to mistakes, misdiagnoses, or inadequate care. So this is a patient safety issue, not just an emotional one.
There's also a darker side to this, trauma contagion. Healthcare workers don't just witness trauma, they absorb it.
Yes, and then they carry that trauma into the next patient encounter. It's a kind of emotional contamination.
So the patient is sick and scared, and the healthcare worker is emotionally shut down. The interaction becomes transactional.
And that transactional nature hurts both sides. The patient feels isolated, and the provider loses connection.
Now, it's easy to blame individual healthcare workers for this, but the real villain is the system.
Absolutely. Short staffing, overbooking, profit-driven models, productivity quotas, insurance battles. These all create an environment where emotional expression is discouraged.
The culture often says, don't get attached, don't cry, don't take it home. But you can't turn off caring without turning off connection.
And that's the tragedy. The very thing that makes healthcare meaningful, human connection, gets sacrificed.
So who suffers? Both patients and providers.
Healthcare workers lose their ability to feel, which means losing their sense of purpose. Many leave the profession or become someone they don't recognize.
And patients lose out on the compassionate care they need.
So what's the way forward?
First, we have to stop pretending numbness is professionalism.
We need to treat emotional health in healthcare workers as a patient safety issue.
And design systems that allow time and space for people to be human.
Because healthcare isn't just science, it's fundamentally human contact.
And if we lose that, the whole system becomes a machine.
To the healthcare workers listening, if you feel numb, you're not a monster. You're a human who adapted to survive.
And to patients, if you felt dismissed or ignored, you're not crazy. You felt something real.
We need to talk about this more openly. It's the only way to improve care and well-being.
That's it for today. I'm Liam.
And I'm Chloe.
Thanks for listening.
See you next time.